start? Good morning. It's my great honor to be the chair and moderator of this panel. And my name is Merike Blofeld, and I am here as a representative of the GLOHRA, the German Alliance for Global Health Research. If you guys don't know it yet, especially if you're based in Germany, please look us up and join. I'm also a professor of political science with a focus on global health and social policy at the University of Hamburg and director of the Institute for Latin American Studies at the German Area of Global and Area Studies. But we are not here to talk about me. We have an amazing group of panelists that I will introduce very briefly because you have their biographies in the app, and so there's no need to waste time on that. And then we will go straight to what I hope it will be a stimulating conversation on the topic of today's panel, and we'll be also eager to hear from the audience. So I'm going to start off with Dr. Alice Lacati, who is a distinguished epidemiologist and public health expert with more than 20 years of experience, and she is currently the director of research and community extension at AMREF International University, which is an affiliate of AMREF Health Africa. And she has lots of experience, including working with the World Health Organization. Next, we have Dr. Joël Kiendre Beogo, who is the Secretary General of the Ministry of Health of Burkina Faso, where he leads the implementation of strategic reforms to strengthen the health system. And he has over 10 years of experience in health policy and systems analysis as a researcher and as a university hospital lecturer. Third, we have Dr. Michael Makanga, who is the executive director of the EDCTP, which is a partnership, for those of you who don't know, between European Union and developing countries for clinical trial partnerships. And it's an EU-funded partnership between institutions funded by governments of 15 European countries and includes 31 African countries. And he has a distinguished career of almost 30 years of professional experience as a clinician scientist. And before he joined EDCTP, he was in clinical practice and academia, and later on in clinical research and research management. Third, we have Dr. Peter Piot, yes, who's a professor of global health at the London School of Hygiene and Tropical Medicine, and actually the former director of the London School, one of the most distinguished universities in hygiene and in global health. He is also the founding director of UNAIDS and Undersecretary General of the UN from 1995 to 2007, and has an extremely distinguished career over 50 years of research, going back to the mid-70s when he was one of the co-discoverers of the Ebola virus. And finally, last but not least, we have Dr. Veronika von Messling, who is the Director General of the Life Science Division at the German Federal Ministry of Education and Research. She is also a distinguished researcher with a career in veterinary virology, and her research career spans three continents: Germany, US, Canada, and Singapore. And we are thrilled to have a researcher in the German ministry, and her expertise lies in strategies against infectious diseases as well. So without further ado, we have a combination of policymakers and researchers and also a funder. And so I'm going to open up with the following question that you'll each have 2 to 3 minutes to address. And then from there on, we'll just continue the conversation. So the opening question is, in an era of rising polarization, populism, protectionism, and plummeting global health spending, how have global health researcher systems coped over the past year, both in terms of the resilience they've shown and the vulnerabilities? And you can speak from your specific bases of experience and expertise. And I would like to have Peter start, please.
Is this working? Oh, okay.
It should work.
Thank you. Thank you very much. Well, good morning, everybody. I was recently in China, and someone told me, George Gao, an eminent researcher, that the Chinese character for crisis has two characters, and one is crisis, and the other one is chance or opportunity, and that's how and these two make the word crisis. Apparently, I don't speak Chinese, and I think that I was thinking of that because we're going indeed through some turbulent times. But I think also these are, you can be depressed, it's a waste of time, or you can say things had to change anyway. And so this is an opportunity for change and for adapting. And before going into the question, I would say, I always think it's good not to only be nearly paralyzed by when the problems are, but see where have we come. Where were we in 2000? Because we're just coming out of 25 years of what probably, or maybe an historic anomaly, but the golden age of global health funding and all that. And compared to 2000, the world of research in global health has changed fundamentally and in a positive way. There are now centers of excellence everywhere. It's no longer a one-way street, and that is really, I can illustrate that in 1976. I was part of the team that isolated Ebola virus for the first time. We were in Antwerp in Belgium, and I've been accused of being a colonialist, but in these days there was not a single laboratory that could isolate viruses in what was then called Zaire. Today at INRB, they do sequencing, there's whatever, there's an outbreak. I mean, this capacity is fantastic, and we should not forget that. We have also like an EDCTP, when you see how that has transformed, into something that is far more, fit for purpose now. But what we have not achieved, and that's where I'm coming to that, is that in a sense, particularly looking at the in our partner countries, is dependency and a lack of equity in agenda setting, and in execution, and how to manage that. And there's also still no real investment from our partner countries in research. That's a big issue. And when I look at universities in many parts of Africa, not in Asia, but there, there's a problem there for going down. We still don't have an African CRO. Because when you look at clinical trials funded by groups in the US particularly, and here big small pharma, philanthropy, Gates Foundation, they use very expensive CROs that absorb a lot of that money. That could be used by an entity in Africa. So how we've been coping, I think that it really depends, because in some countries, that takes South Africa, there a lot of the global health research was nearly entirely dependent on US funding, NIH funding, and plus PEPFAR when it comes to HIV. And that has been very heavily affected. Now, last week or 2 weeks ago, NIH said that they're restoring the funding. So it's a disruption. People have to let go. Then, I mean, the chaos that involves. But I think that, for me, the main thing is that we now have put on the table, and I can come back to that later on, about what should the future be and how to reset, as the Accra summit on the 8th of August said, in terms of global health in general, that agenda. And that's what that's now on the table. And so that's making use of that crisis for something positive. And I could give many examples of negative things. And finally, yesterday I was at a session that I think could be a game changer, and that was an initiative in West Africa for Lassa fever, Lassa vaccine. Where it's really, it's with CEPI and IAVI and an ECOWAS, and then a whole coalition of West African countries that are affected by Lassa, and where they're now thinking of not only doing the research, but also end-to-end with manufacturing, market shaping, and everything. For me, that will be, I think that cannot fail, because that's going to be a game changer. Over.
Okay, maybe we can return to that. Thank you.
Yeah.
Veronica,
What else
you
is
of the
there?
German government.
What else is there to say? Peter covered a lot of the things I think that are on all of our mind, right? That is that it's a bit like the stages of grief. So we had this huge shock to the system, and now we are looking at it and exactly saying, well, that wasn't the perfect system. It was the system we had. Now that's gone. It's not coming back.
Yeah.
And I think that's like the first stage, right?
Yeah.
It's gone. It's really, really gone. So now I think we've moved on to the point where we look at it and say, well, how would a system like this, like a system that's fit for the future, look like now that we are rebuilding? So I remember this whole rebuild better slogan. You know, Americans are really good for slogans. And I think that really kind of is a really nice, nice focus point. And so that is what is driving us. So in the early stages, there was a lot of, well, who could be stepping into the void?
Yeah.
No one. Why would we?
Yeah.
Why would anybody want to?
Yeah.
And saying this is callous for in these early days, in that situation where all of a sudden the drugs are gone or the study is collapsing. But there's a lot of truth in this, that nobody can. And this other question that I'm asking, well, why would we? Is not why would we as rich country, but why would we as a global health community, let's think about how to build something that is actually able to withstand this type of blow. Because the truth that we, I think, all are not so happy to seeing is, if you turn this around and ask, well, how could the decision of a single person have such an impact on a whole system? That is a question that we have to ask ourselves, right? Each of us, each of us as actors in that system. And if we answer this honestly and forward-looking, then I think the answers we get will help us shape that future system. And it is a lot of what Peter already said. It is that it's partnerships. It is, what are we bringing to the table and what are we getting out of it? And I think the honest answer to these questions will actually be very helpful in then shaping this new ecosystem that we are now having to build and wanting to build. And that leads me as a funder. I think Germany has been a very staunch and steadfast supporter of global health in general. And so our ministry is looking at the research end of things, and we have always considered this as an investment in the future, which research investments always are, irrespective of where you make them. And research is, and the question of partnerships, be it on the EU level, but beyond, that's the basis of research everywhere, and especially also in global health, because there will be no success unless we partner with the stakeholders that are involved, and as always, this is hugely complex. What I think I would like to challenge you with a little bit is this question. So if we want to rebuild, well, what is it that we want to have? And so there's always the inertia of let's continue what we've been doing, because all of us have been doing a good job. We've been really engaged. We are motivated. We are inspired. We want to make the world a better place, all of us. But we now have to take stock, and we have to think about how do we want to move forward? And that means looking at this realistically. It means that there will be less money available.
Yeah.
Be it because money becomes less valuable, right? We have inflation, or be it that money has to be dedicated to, so there's more competition, no? So we have to have a business, a value proposition that competes in right now and in the future. And that means we have to revisit arguments that have worked in the past and be honest about, is that argument still holding water?
Yeah.
Is it still going to be successful? Is it going to convince somebody else to invest in this opportunity?
Yeah.
And we struggle with this, all of us, me included, because we feel, why should I have to prove that this is an investment where somebody gets something out of it? But if we manage to do that, we are hugely successful, because then we feed into the desire we all have to improve situations, but we connect this with this makes sense, this is good for me too. And so I think a lot of what has happened in global health and a lot of what we fund has already yielded dividends. This investment has already paid off. So it's worthwhile to say this and to focus and to say, yes, there's lots to do, but also we have come a long way. Like you were saying, 2020 or 2015, how did the world look then? And what have we achieved? And is that enough? No. But is that really great? Yes. And so thinking about how do we make a good case, we're not starting from zero. Yeah. It's not virgin soil, right? We've already worked really hard and we've had lots of successes. But what we are lacking a little bit is an honest evaluation of what was a success and what maybe not, and maybe that has to stop or to change. But I think now is the time.
Thank you so much. And I would love to hear, this is a great setting also. What do we want to have to turn to Joël for the opening statement, and also from the perspective of working for the Ministry of Health of Burkina Faso, given everything Veronica said, what would you like to have, and also how has the last year been for you? And then we can return later to Veronica to ask exactly what these concrete steps of a new vision might look like in the German ministry. But Joël, please.
Okay, thank you very much, and it's a pleasure for me to be part of this important discussion. And I think that global health research system have not disappeared in spite of geopolitical shift. And in Africa, we see lots of initiatives. And Peter talked about initiatives in West Africa. We also have some initiatives like Africa, CDC, and these are new forms of collaborations that emerge. So these are regional initiatives that are very, very important. And these institutions don't rely always on partners from the north, and I think this is important to stress, and this is part of the resilience. Mm-hmm. But we see lots of vulnerabilities in these moments, and I think we can talk about financial and geopolitical vulnerabilities. Yeah. Because global health research remains heavily dependent on external funding. Yeah. And also with crises, there's a risk that because of that, if the priorities are politically driven rather than equity driven. Yeah. And there's also a risk of increased competition because of the lack of funding, with limited funding, so we'll see increased competition and also some uncertainty about the support for global public health goods, for example, related to disease surveillance, neglected tropical diseases, and also climate health. So I think that these are vulnerabilities we need to stress. The second vulnerability I see is structural, because as research funding comes from the north. This means that they have some power for agenda setting about this research, and also they have sometimes authorship control. We see that in our setting. So this means that research can be underfunded. So I think that these are the vulnerabilities we can stress from the perspective of low and middle income countries, and especially in Africa.
Thank you so much. Alice.
Thank you very much for the opportunity to speak in this panel. Let me say I come from Kenya, and this, what you just described, one person made a decision and things change. But I must say that when I look at the situation where we were already, research was already underfunded in our settings. So because the research funds always came from the West, so as my colleague said, they defined a priority. So it also gives us an opportunity to look back and define our priorities. So I recall some time back when I spoke in one of the conferences, and I said that African universities must define their own priorities, because a lot of the times the research is actually, the call comes from outside and we apply for it. So we are actually aligning to that call. And now we are in a situation whereby there are fewer calls. So it is an opportunity for us to define our priorities. But also, it came at a time, if I look at our setting, when governments, if you look at universities in Africa, and if I can speak for Kenya, they're really struggling financially. And the universities have been advised to look for research grants as a way to create funding, as a way to strengthen your programs. So this is like a double challenge. But it has also now given us an opportunity to speak to our government. I know that in Kenya, the government is not spending it is only giving 0.8% of the GDP on research. So this is an opportunity for us to speak as African researchers to our own governments, and also an opportunity for us to strengthen partnerships, because diseases have no borders. Somebody said in this conference, the virus will not ask for a visa. So for me, the partnerships with the global north remains important, because I think we can, as researchers, we need to lead the way in addressing this geopolitical change.
Thank you. Michael.
Thank you very much indeed. I have to say that we are indeed living through a very paradoxical time in global health research. And when we look at the past years, what they've shown us, it's very clear that international collaboration can save lives and accelerate innovation. When we look at the impact of work that has been done, the most impactful work is the work that has had extensive collaboration that is done in a very balanced way. And yet, this is what is now suffering most. This is the time when we don't have to lose momentum despite decisions that have been made in some parts of the world. This is the time to be resilient. What have we learned? We've learned that resilience in research is about more than money and infrastructure. It is about trust. It's about networks. It's about partnerships. And it's about a shared purpose. When I talk about trust and look at an organization like the Global Health EDCP3, we have a partnership that is bringing together the European Union, all directorates of the European Union that are working on global health, converging around the common agenda of global health, bringing the member states in Europe and Africa, and a platform has been established where there is more than representation, but a platform for co-decision, where representatives come to discuss a shared purpose in terms of strategic research and innovation agenda, and to discuss priorities that are of common interest and are relevant to the countries, both in Europe and in Africa. Now, that trust does not come easily. It is a trust that is built over time, making sure that it is more than just inclusion, but really very active participation at all levels. Levels in priority setting, levels in allocation of resources, levels of decision-making and management, but also shared responsibility in what comes out in terms of results and in terms of risk. Now, when it comes to the networks, I have to say that looking at the lessons learned from COVID-19, this is a time when most researchers had to move back to their own countries to support their own countries. But the capacity and infrastructure that was established and the human resources are the ones that now led the response in countries. And that took time of building that excellence and leadership in countries. Now, this is contributing to the confidence that comes now that when you talk about a partnership, you look at a partnership that is bi-directional, where there is mutual learnings, mutual exchanges of ideas, but also when it comes to supporting this work, that when funds come in, the countries also take ownership to ensure that there is taking this forward. Another learning in terms of resilience, and I want to draw again from the COVID-19 situation. We always talk about neglected tropical diseases. In our experience, the diseases, the work that was most resilient was actually the neglected tropical diseases. And part of this was that this work was conducted in a setting that was very much integrated into the national health systems. It had that backbone. And that backbone was also supported by the countries, but indirectly. So when we are looking at building a clinical trials ecosystem in a resilient way, we need to look at some of the very important backbones that the countries where this work is happening contribute to. And these contributions to be recognized as co-funding to this work. And when there is this co-ownership and this recognition, this work moves forward in a more constructive way. Now, coming to the shared purpose. We are at a time where interconnectedness is key. Interconnectedness when it comes to dealing with diseases, looking at areas where there can be benefit when diseases are supported together. Of course, this, when you're looking at research and development, there are areas where work has to be done focusing on a disease, but then looking at the areas where the innovation meets implementation to ensure that bringing in the local context and the funding that is coming in countries to support this going forward. Now, that sends a good signal in that the community recognizes that these diseases are not happening in isolation. The other crossing is on the side of the technologies. We're at a time where we are looking at the digitization of research and clinical trials. And again, I want to draw from what we're observing in neglected tropical diseases and emerging disease of epidemic potential. These are some of the diseases that have been grossly underfunded, but they are taking advantage of the digital evolution to reach the very people that are very far removed, the rural remote, urban poor, connecting them with digitization. This is an area now of taking advantage of shared purpose as part of partnership.
Yeah.
And the last piece is the way that we embrace working together in terms of bringing in the funding that is coming from the public sector,
Yeah.
be it from the union, be it from the member states, so that this recognizes the contribution and the strength that is coming in from the private sector. We are now, when we look at the successes that are happening even now, these are dependent on blended financing, where we are having contributions coming from the public sector, from the private sector, and the philanthropies that are bridging these funding gaps. Because often we don't have this end-to-end funding of product development, and it has to depend on multiple sources. This is where we need to adapt and make use of what exists.
Thank you. Thank you very much. And you have all brought up the need for change. And I'd like to go back to Alice and Joelle now to probe that a little further. I mean, the global health governance, it's shifting rapidly. We've probably all been to panels over the last 2 days discussing these similar issues, how it's changing, whether this crisis is an opportunity, in what ways. The governance and funding still, however, reflects the interests of high-income countries. And so I'd like to ask, especially you, what needs to change, specifically, more concretely, to make it more responsive to today's multipolar world, and also, as you were already saying, the issue of reliance on external donors versus the need to focus on local, national research priorities, which may require very complicated and difficult things, especially in low-income countries, such as developing or expanding your own domestic tax base, which, like 101 of politics, is that nobody likes to be taxed, and so it's not easy. How do you see the steps forward? Maybe starting with Joelle and then Alice and whoever else wants to add to that.
Okay, thank you very much. I see some fundamental shift, and I think that we need shift in power, because the world, as you said, is multipolar.
Yeah.
So we need plural leadership. And what I mean by plural leadership, it means that we need that staff actors' voices are heard, be they from researchers, civil society, regional bodies, or policy makers. And I think that we also need that these voices have form a role in setting global priorities, and also be co-authors of a global agenda and not just implementers. So I think that we need this shift in power. As you said, we also need shift in financing. This means that research should not rely only on the West part. We also need domestic financing.
Yeah.
And for domestic financing, people usually think about national budget and funding from the public. But I think we can also leverage private funding. For example, in Africa, we also have some philanthropy.
Yeah.
So I think it's important to think about that, because some people are very rich. So we need to also tap there.
Can I ask a follow-up regarding specifically that, the philanthropy? Do you see that would ideally be challenged, channeled, through the public sector or operate independently, right? Because you could have philanthropic inputs coming in with the coordination of the government, or do you see that as a separate? How would you envision that?
I think we need both. We need both because if I support the public sectors, it's good, but sometimes they'll also want to show a kind of advertising. So I think we need both because it's not well structured in Africa. So we don't have lots of foundation or something like that.
Yeah.
Well, sometimes it's just what I can say. It's not in the long run. It's just made at one point. So we need to better organize it.
Yeah.
Well, so we need to have better structure funding from philanthropy in Africa. So I think we need both. They can support the public sector, but I think that they need to be better organized themselves, like philanthropy in the North, to be able to fund the global health research. Okay. So I also want to mention that we need a shift in mindset. So this means that expertise and innovation can flow from many directions, not just from the north to the south. So we also need mutual learning and also co-development because we have very interesting experiences in Africa. So, for example, related to resilience, we talked about the neglected tropical disease. So we have some experiences there. We also have some experiences regarding community engagement and also solidarity in Africa. So we need to also learn about that. So in short, I can say that we need a value distributed and collective intelligence to reflect this multipolar reality. So we need bilateral exchanges and not exchanges just from the north to the south.
Yeah.
So it's what I can say.
Thank you so much. Alice.
Thank you. I want, first of all, to just maybe change the thinking of research, because a lot of times when we are thinking about research, we are talking about expensive clinical trials, which really take a lot of time. That's really very important. But I want to say that in this summit and throughout, we have known that it's very important to invest on primary healthcare. Prevention, prevention, prevention. This is an area that we don't think about in terms of research, because coming from Africa or even Kenya, we know that the investment in primary healthcare is what that is going to make the greatest change. So investing in low-cost research in primary healthcare is really going to make the greatest change, because that is where we are going to achieve health for all. That's where we are going to achieve universal health coverage. So I want us to reflect on how do we have research that is done at the primary healthcare level, because some of the interventions are assumed to be very easy or are assumed to be direct. For example, breastfeeding. How do we have research that promote breastfeeding? It is life-saving. How do we have research that is going to promote immunization? So for me, how can we invest on low-cost research that is going to impact on our primary healthcare settings? So that is, first of all, for me, the shift that we need to have in terms of research in our setting, so that we can influence health for all. The other shift we need to have is we need to have the shift in terms of our own internal collaborations. Working from a university perspective, one of the things we struggle with is our own collaboration. How do we collaborate ourselves and harness the little resources, even across departments? So for me, that is a shift we must have as researchers in global health, as academicians. How do we collaborate within our own universities within the same countries to use the limited resources? How do we partner across the region so that we are not always looking for a partner outside, very important, but let us first of all harness our own resources to contribute to research that advances primary health care. So for me, that is the other shift. Then the other one is strategic alliances. So because as I said earlier, diseases have no borders. We definitely, I came from Nairobi the other week. If I was sick, I've already brought a disease here. So we definitely have no choice but to work together with the North in advancing research. So for me, we need to work in what we call beneficial partnership. And Dr. Makanga already talked about respect, talked about partnerships that we are really asking ourselves, is there learning? Are we building capacity in both sides? Are we influencing health in both sides? Because learning is not always one side, it is both sides. So for me, that is a shift we must have to be able to advance research.
Thank you. These are really interesting points. And just feeding off what you were saying about the importance of primary health care, and others also pointed to the importance of national health systems and really strengthening those health systems and the importance of agenda setting and the local. How do you envision that kind of funding needs to come more at the national level? Because obviously if it's donor funded, as in the past, then it shifts the priorities. And if so, how do we see basically, Joel, you were bringing up the importance of philanthropy, like local philanthropy. And then the issue of government budgets and how do you see local stakeholders and advocates with voice and influence who can push for these kinds of policies and more attention at the national and even subnational level? Do you see any kind of process, a political process there that would help focus on the issues that you say are incredibly important?
So,
as a follow-up question.
So for me, I see one of the things we have to do as researchers is to recognize that we also have to be in the political space. We cannot just be in the labs, in the classrooms. We have to learn that skill to negotiate. In whatever forums we shall be in. So for example, you will see university lecturers go on strike. They are going on strike because of salaries. So they can also use the same forum to demand, and it is already happening, for government to fund research in our local setting. We are also seeing local philanthropies slowly supporting research in our setting. So there are those opportunities. Maybe some of them you don't know them, but they are happening. So I see that there is an opportunity for us now to also speak politics about funding research and demonstrating that this research is going to save lives, is going to contribute to, for example, now our primary healthcare systems are going through redesign because of the change. We have been having horizontal programs. Research is going to help us in advising which is the best way forward. So I see there is an opportunity to negotiate with our governments, and we see that happening. They are slowly listening. They are not yet there, but we just must continue the push.
Opportunities to negotiate with our governments. Joel, how do you any additional thoughts?
No, I think that I agree with what she said. Because we need to speak the word of the politics to be heard. Because sometimes we do research, because I also have a research background. And now I move as a policy maker, and I think that the expectations are not always the same. Because as researchers, we satisfy with what we do, with the results we have. But politics need practical solution
Yeah.
that come very, very quickly.
Yeah.
So we need to be aware of that and to adapt. Unfortunately, we don't have a solution
Yeah.
because of sometimes the research process.
Yeah.
But as she said, we need to develop some research that are not very heavy, that
Yeah.
can be done very, very quickly.
Yeah.
So I support
Yeah.
what she said, because if, as a policymaker, the kind of results we use, sometimes I said is past result. So we just do quick review to use it. But when new challenges emerge, the time that the researcher finds the solution for the policymaker, sometimes it's too late.
Way too long.
And when you come, say that, well, okay, you
Academia
have a
is so
result,
slow.
but it came very late.
Yes.
So
Oh, you had follow-up? Yes, go ahead.
Can I just add? And I think also as researchers, we need to show our politicians the value proposition, because that's
Yeah.
what they don't see. They see us doing research so that we can publish, rise through the ranks. We need to
Right.
show the value proposition in terms of, now that we are redesigning our primary healthcare systems, how can we add value to give the right decisions? So that is a value proposition we need to sell as researchers. We need to come out of the labs and publications, but also share these findings in a way that
Yeah.
they can understand.
Yes.
Yes.
Yes, absolutely. I think that's so important. And it feeds to what you said in your opening speech, Joel, where you also mentioned the importance of civil society organizations. And of course, there you can see like the organizations that you want to hear from when you design policy are researchers with evidence-based information, and also civil society advocates on different issues. And when you mentioned that, I was wondering actually if you're speaking more on the international or the national level. My guess is you're probably speaking both. But they are also, as a policymaker, do you have a vision there, this kind of civil society and researchers in society? And you even mentioned that it would be good for them to have a formal role in the policymaking process. Do you see that happening in Burkina Faso, or is that something that still needs to be worked on?
yes, I see both, but it depends also on the period.
Yeah.
Because when you are in an electoral system, it's not easy to see a lots of protestation, because when in our countries, when we talked, for example, about civil society, the frontier with political parties is not always very, very clear.
Yeah.
So sometimes the politics don't see in a good eyes, I can say, civil society.
Right.
But when you don't have this kind of interest, I think that civil society can be good partners,
Yeah.
because they highlight lots of issues
Yeah.
in the society, and the government can look at it and also be very careful to the issue that people face.
Right.
So I think that it depends on how we see things. But in Burkina Faso, we used to involve civil society, be it in the policy process planning, to be inclusive.
Yeah.
But sometimes it's more symbolic.
Right.
Sometimes it's more symbolic. So we need to build better ways for them to be able to contribute more in the planning. Yes.
Thank you. Veronica.
I just wanted to say that that is definitely not a global South issue. So whatever has been said applies exactly to us.
Absolutely.
I'm not saying that it's not different levels on what we're talking about, but the issues that are here that you are raising are issues that we grapple with every day. So we also don't have solutions, obviously, right? We also, there's a continuous effort. So this question of if I do high quality research, usually I have the answers way later than any type of policymaker would want this. That, I think, is a universal challenge that we grapple with, this desire that the researchers should communicate what they do, why they do this, why this is important. Oh, I'm sitting in countless meetings where that is the topic, and how do we mobilize support for research and education in competition with other domestic agenda items. That's our daily battle, so to speak, you know. But why I'm saying this is because that means that might actually be another dimension of collaboration and learning from each other. And I think we are pretty much all in the same situation, or in very similar situations, and we definitely don't have the answers. But we are trying, and so by exchanging about that, I think we might actually all have a mutual benefit. That's obviously maybe a side issue, but money never is a side issue, right? Because ultimately, money and mobilization of funds will determine what we can do with them, and so this might actually be really worthwhile.
And talking then about funding and going back to a slightly more global level, and you've already addressed this, but I'll direct this, I guess, to Peter and Michael, perhaps more, at least at the beginning, is the current global funding models, for what they are in global health research and innovation, the World Health Organization, EU Horizons, product development partnerships, etc. How are they working in this era of instability? And do we need new mechanisms to buffer against this instability? And if so, what? Like, given everything that's already been said, do you have something else you would like to add about what we should focus, like what would be helpful tips on this issue? And maybe start with Michael and then Peter.
Yes, no, thank you very much. And if you allow me to just start off connecting it to the discussion that has been going on.
Yes.
Because at a timing like this, when resources are limited, I know that it is natural for the countries to really focus on certain areas. I am extremely for prevention and ensuring that primary health care is supported to the highest level. But it's always very important as well for countries to maintain, not to lose track of the global trajectories, to ensure that at times like this, when you're likely to have shocks, you need tools that work for treatment, for curative services. You need tools that work for prevention. But you also have tools that will help you in prediction of what may happen. And this is where you invest also in areas such as genomic surveillance. When we talk about preparedness, what has been life-saving in some situations is because some pathogens have been predicted and identified early so that there is a timely response to avert more significant money loss. And that brings me now to the models of working. I see that, of course, having diversified sources of funding is important. Charity begins at home. There should be domestic funding that leverages international funding. And in this case, looking at public funding that may come from multiple sources and also private funding. But looking at models that will reduce the time of development of interventions. And to me, the public-private partnerships, that approach has worked. And having early interaction also with regulators so that certain things can be done and funded in parallel helps to reduce the development time. Looking at establishing platforms that can be diversified to address multiple diseases, where you look at adaptive clinical trial platforms. We've seen this, where you have platforms that have been developed for HIV, diversified to address TB, diversified to address other diseases that are coming on. This, in a sense, reduces the initial infrastructure development to kickstart the trials and for these to run in a shorter period of time. And also, now, the other bit is embracing the funding together with more innovative and adaptive designs that are also going to reduce the time, the people that are involved, and also the resources when you put all these things together. The other piece that is important, that is coming up strongly, is the end-to-end product development mindset, recognizing the players that are involved in this early, so that you're looking at discovery, product development, clinical development, and the access piece, the post-registration work, and also the local manufacturing. Because this is an area that is very important to the countries that are affected. And they may be more willing to put in resources when they really see the big picture and how this translates. So this calls for more interaction between the sources of funding. And this is one of the areas that we are looking at in terms of the innovative models of supporting research and development during this era.
Thank you. Peter.
Thanks a lot. I fully agree with what Michael said, and a few reflections. One, I think this is a time for a cold and hard look at the whole system. It's an ecosystem. You mentioned product development partnerships. There are enormous number. They're all based in the north. I mean, in Europe or the US, with one exception, one in Seoul, in Korea, and do it in a constructive way. And I think there is here a case for rationalization, consolidation, mergers and acquisitions, as they say in business, and that not only to save money, but also to reset agendas along the lines that we heard from Alice and Joël and Michael. But I think that this is, again, an opportunity, as long as this is not leading to an epidemic of meetings and consultations and so, etc., because that's always the risk, you know. We need to set, okay, by whatever the end.
Become an epidemiologist, meetings.
Yeah. We have this at the moment. But I think this is something that that should happen now. But then two, I would say that there are, and we can go into details, but not here now. But two, also at the regional level, there are a number of initiatives already, and just would like to stress also what Michael said, that breaking down some of the silos. I've been involved a lot with some others here on, for example, the HIV, networks and so on. During COVID, some of them were used for, COVID research, but it's been very limited. And there were restrictions actually imposed by the donors to what you can use that platform for, which is actually, when you think of it, a very negative aspect of what you could call generosity. So that at least, and we should also look at beyond health and global health in terms of research. There are a number of regional initiatives in Africa that are really flourishing, like in mathematics. There is an African Academy for Mathematics. Of course, in math, you don't need that much money. You need the brains and the people and so on, but you bring them together.
Yeah.
But it shows that there are initiatives that are entirely driven by Africa.
Yeah.
And I think we should think of it and team up with them, particularly now that with the digital revolution and AI and so on, we can't ignore that. We can't just continue to stay in our comfort zone. And also look at Asia. When you look at Asia and Latin America, where they were in 25 years, I mean, they are probably, certainly in Asia, we are also struggling, as Veronica said, with the same issues and for research funding and so on, but the exceptions are in Asia, where the budgets are going up. And so teaming up with them and
don't
opening.
have anybody from an Asia-based institute on it.
Yeah, but yeah, exactly. But I think that, and they come with some totally different perspectives. And now whether it's China, I know that's not very PC, but you know, in India there's a lot going on, etc., etc. And the way that they approach things are very different from what we see from here, from in Europe, for example. And so these are all golden hard look. And then a second point I would say is that we need to see how to connect that with, there is a movement for, let's call it health sovereignty in Africa.
Yeah.
That is not research driven, but we need to see, can we ensure that there is some research component in there, but along the lines of, Alice, what you said, because that will be very important for, for reducing cost, for increasing efficiency, better return on investment, and so on. There is a need, without that kind of, basic research agenda, and it's innovation in delivery, not only delivery of innovation, that will, and because that's what we're trying to do in Europe also, is positioning some of the research as, in our case, biosecurity and all that. So we need to think of that narrative, as several have said. Another point I would say, the last point is, okay, at the end of the day, where will the money come from? And we have to be realistic also. Sometimes I hear that everything will be done by the countries, and that's also not realistic. So there will be a need for continuing, partnerships is the right word. I would say also co-creation of the agendas is really important. And not, okay, we set the agenda here and then we consult to see and to make sure that people, agree to that agenda. That's the wrong approach. So co-creation. And that money, okay, there is a need indeed. There are official commitments to spend. I can't remember what percentage of GDP or in Africa to research, but no country is respecting that. But just continuing to do that. But then there is also philanthropy. Bill Gates has announced he's going to spend $200 billion in 20 years, and he said most of it will be in Africa. Now, a lot of it is already, I guess, carved in stone, what they're working on. But still, what I think that can be happening, and what I see in Asia again, is that other philanthropies come in, the local ones, you mentioned, Joel, but also, for example, the MasterCard Foundation has now a program to support something that's really important and close to my heart, universities and higher education, because what we do when we talk about capacity building, which is a terrible word I find, but it supposes that there is no capacity, and then that it's about individual researchers and so on. That's very important, and that's been pretty successful. That's why we have, there's not a problem of talent here, but the problem is often the enabling environment, and it goes from digital support, how to go for grants, the monitoring, evaluation, the reporting, and all that stuff. And so MasterCard Foundation, and by the way, that's led by John Kengasong, Cameroon, who was until recently, until he was fired, the head of PEPFAR, same person who did that. And then I would say, when taking a longer-term view, and that's something that could be part of the narrative, is that I'm a big fan of is end-to-end of manufacturing, and that's why I mentioned this Lassa vaccine initiative, but also like Institut Pasteur of Dakar, soon will produce yellow fever vaccines. The European Commission 2 or 3 years ago allocated 1.1 billion euro to support manufacturing vaccines, which is, by the way, the most difficult part to start with. But there will be manufacturing of dual bed nets in Nigeria. Africa is 95% of the market. There's not a single dual bed net that's produced in Africa.
Well,
and now we'll see that.
Okay.
You know,
yeah.
but so, but I was going to say, if that develops, that will create jobs, that will, you know, attract then talent to stay, and that will also be a source of, you know, of funding.
Yeah.
But this is more long term.
Yeah.
That's not going to
Yeah.
happen
Yeah.
overnight. And so I think the EU, we have really to make sure now that this all is on the agenda.
Yeah.
Ursula von der Leyen called for Global Health Resilience Initiative.
Yeah.
It's not yet clear what it is, so this is the time to,
Thank you.
to
Yeah.
push
yeah.
for it.
Thank you so much. So I noticed there's a lot of agreement on this panel, and people say that what makes the panel really interesting is if there's some disagreement. So, but I don't know if this will lead to disagreement, but let me ask something a little bit more pointed. I just want to take a few more minutes with the panelists and then really open it up for audience questions. Given the topic and future-proofing in times of geopolitical shifts, everything we've said, and Veronica, you started out by laying the challenges, which are very much there. What is and can Germany do, and especially your ministry, as next steps, and also taking into account maybe, if it makes a difference, what you've heard on this roundtable today. If you can just say a few things like where is Germany heading? We heard these great announcements about continued and enhanced multilateral support for global health here at the conference for the Global Fund and for CEPI. In terms of global health research specifically, and then I would also turn it to the panelists, whoever would like to say, what do you think Germany should do? And do you have anything now that you have a German policymaker here that you would like her to hear before you leave today? But I'll start with you.
Well, I guess I have to kind of let out the air of the balloon, huh? So, first of all, given that people usually propose things that they want to do, not that other people should do. So let's start out with this.
Okay.
But let me tell you what Germany is doing, and you just pointed it out. We do consider ourselves as a reliable partner. That's our aspiration.
Yes.
Partner, not donor, at least when it comes to research. So that means that we are continually looking at our investments, at our funding programs, and we are asking the questions that we ask in all other areas of research funding. What do we want to achieve? Do the programs deliver? Mm-hmm. Are there new areas that we want to move into? And are there areas that we have to then stop investing in because like the pot of I can only spend
right
like anybody else, right?
Exactly.
And so the first question maybe is, will there be more funding for that type of research?
Yeah.
My impression is no.
Yeah.
So that means we are on the one hand working to maintain levels that we have.
Yeah.
Will we succeed with this? My prediction is no. But that means even more so that what we have has to be weighed as where can we have the biggest bang for the buck, right? And looking at our investments, I very much agree that the product development partnerships are at the moment a big success story. And they have a lot of collateral positive effects that we didn't know when we started out and that we are very excited about and that we are looking at with the question of, is there something to build on?
So they're actually performing better than you expected.
Not necessarily better if you say, so you know, it's like a clinical trial. What's your primary endpoint? Do I have a product, yes or no? Yeah. As it always goes with research and product development, usually the answer is no for longer than we would wish, right? Yeah. But there's clear progress. what I'm saying is there's secondary endpoints that we may not have had realized, like this capacity building, like having discussion spaces, having networks built, having secondary partnerships developed. So all of that. So this ecosystem aspect. Another point that was for us new space, let's put it this way, was this partnership we have with research funding in sub-Saharan Africa, where we are funding African researchers to pursue research. That is also something where we are keen to see how the host countries now, what's the role that they will be taking with respect to financing, because research funding in our context has a beginning and an end.
Yeah.
That means that a project is selected, is funded, and then ends, so that the money is freed up to have a new project. And when you start talking about capacity building, that's when we have to ask again and again, so which of these parts do you feel are infrastructures that you want to keep long term, and how will you be financing this? And looking around the room, seeing German faces here, they know that, because that's the same procedure in our own country, where if we fund a network for a certain period of time, the expectation is that there's other, if this is actually valuable, there's other actors that step in to keep that. And so this will be, for us, the North Star, that how do we have apply the investment, the money we have, so that it has the largest possible impact on global health research.
Thank you so much. Yeah, okay, and let me rephrase. You can tell that I'm not a diplomat and I'm an academic, so let's get some discussion here. Let me rephrase. Does anybody on the panel have a question or a comment to make to any of the other panelists that you think that you would just like them to hear a point before they leave today, that perhaps an issue that is below the radar or didn't get mentioned and you would like to share? Michael, and then after that, Peter will move to the audience.
Yes. Now, thank you very much. And first of all, I want to thank Veronica, who is representing Germany. And Germany is one of the founding members of the EDSTP program. At a time like this, where funding is reducing and country commitments may be reducing, and at a time like this where European competitiveness is high on the agenda, my plea is that Germany takes the added step to consolidate and not to step down on global health international cooperation. And this is purposely, when you look at, I've just been at the European Conference for Tropical Medicine and International Health, and when I look at the very highly impactful research that is presented by German researchers, it is really research that is based on solid international cooperation.
Yeah.
So investing more in this space at a time like this, where there are global trends on climate and health, AMR, digital health and AI innovations that are really progressing, this would be of added benefit to Germany, while at the same time really promoting global health and consolidating the investment that you've built on. Thank you.
Peter, very briefly. And then
Yeah, very briefly. Yeah, I'm not going to tell what Germany should do. I'm from Belgium. No, but just as a European, I would like to follow up on what Michael has said. I think there's in Europe, there's the budget, the new budget is being discussed now, and it's really important that with all the pressures that are there, from defense and just name it, that support for EDCTP, but beyond that, for global health research and global health in general and development assistance for health is maintained. And that will come through pressure from the member states. And also the fact is that it's the global gateway, there's a lot of money, but it's really mostly used for infrastructure strengthening, etc. And the people in charge, they don't like the soft stuff like global health and health and so on, education whatsoever. And so I think there we need to have a collective lobbying effort. This is the time to do that.
Okay.
And
everybody take note?
And then, and I won't repeat everything Michael has said, but that's going to be,
Thank
even
you.
for you, EDCTP, if that fails, then we're all in trouble.
Okay. Thank you. Alice.
Thank you. Just honored to be sitting with the German government. Let me say, for me, I have a lot of respect for this country. One, because they've made education accessible. University education is accessible, and I know that somebody is paying for it. So it's not really free, but it's made accessible. So what that does mean, somebody is given an opportunity, and an opportunity makes a very big difference to anybody in any village in Africa. So for me, my request is how do we co-create, work with universities in Africa to co-create solutions to support research that is going to impact on primary healthcare. So that is the opportunity that is my request for the Germans. Thank you.
Thank you. Now I'm going to open it up to the audience. Questions? I think there's supposed to be somebody who, I see one here, here, over there, and there. Who's carrying the microphone? Could you give it to that lady? And then maybe who next? Go ahead.
Hi, my
Very
name
briefly, thank you.
Sorry, yeah, my name is Tharani and I'm from McGill University. And so my question is, we've sort of seen that people say that a silver lining for how sort of funding cuts happened is that for the first time global health has been decolonized, right? So if this were to change and if different donors were supposed to come in or previous donors were supposed to come back, how do we see sort of the power of community engagement actually being the center of global health? And that it's not just like a fluffy term, but something that's actually, that concrete action is taken towards.
Thank you. Let's take a round of questions, and then the panelists can kind of choose what they answer in the time we have. There's this lady here, and then I saw a hand over there.
Thank you. Good morning. Great panel, positive vibes. So my name is Marlene Temmerman. I'm working in Kenya at Aga Khan University. And I really want to congratulate the panelists. I think resilience, EDCTP, Michael, has gone through many, many COVID times and others and has been growing. So congratulations. And I think there are now 31 African countries who are already paying their contribution. Yep. So besides public and private money, there is also commitment and more to come. So I think that's a very good example of what can be done. Veronica, very happy to hear we don't start from zero. On the other hand, sometimes we start from positive, but we go backwards. Look at maternal health, maternal mortality. Yeah. In the MDGs, we reduced, thanks to primary health care and many things, maternal mortality with 40%. It's really historical. But now, 2015, it's like we close the books and we see maternal mortality going up. Yeah. So we don't need to reinvent the wheel and do new research. We know what needs to be done. Why don't we do it? And then to my African colleague from Amref, I fully agree on primary health care. But we are singing that song already since 78, right? Health for all by the year 2000, primary health care, which is correct, and we should continue. But also let's look at the lessons we can learn. HIV was a vertical program, but thanks to leaders like Peter and others, it has also changed and had a huge impact on health systems, positive impact. Yes. So let's look back at what worked well, what can we do? Just to end, I'm also a former politician, and I know we have to do as researchers good research, and we publish and we think it makes a difference. A little bit, yes. But parliamentarians, they don't read the Lancet, and they shouldn't. We should do better in bringing that particular message, and I'm happy to end with that Peter talked about co-creation. Because usually we make a proposal, we meet something, we ask a minister to sign, and we call that co-creation. Co-creation is really working from the beginning. And one of the donors, IDRC, it's mandatory that one of your co-PIs is a government official who is interested in research.
Thank you so much. Let's take a couple more, and then the panelists can. There's two. There's one guy there and one woman at the back.
No, I don't want the name. I want the time.
Okay, thank you so much, guys.
Very briefly, just.
Yeah, thank you so much for the much-needed discussion. Hi, my name is Ahmed Hussein from Sudan, a medical student representing the International Federation of Medical Students Association, representing over 1.5 million medical students. So I want to ask, with these geopolitical shifts affecting us and our academic institutions, how can we ensure that future researchers, future junior doctors like us are supported in global health research, especially with the, affected, funding that basically that was discussed earlier.
Excellent question.
Thank you so much.
There, I see two hands. Can you combine your question, please?
We can try. Yeah. So thank you so much to the panel. My name is Noreen. I'm from the University of York. So my question is linked to the discussion around primary health care. And for me as a researcher, I think I struggle a little bit with how innovation is defined. Because for me, innovation is very context specific. And what is ordinary in one setting can be innovative in another. But when you apply for grants, for example, they need innovation in terms of artificial intelligence. I can't just plug artificial intelligence in a community where there is no data set, So I think we just have to think a little bit more about how we define innovation and define it in a way that enables us not to lose what we've already built. And I think that's the problem that we have with pushing primary healthcare forward. We have moved to AI and things like that. And
that's a very interesting point. Thank you. And can you just in like half a sentence, go ahead.
Half a sentence, thank you. Kevan Bozogmer, I'm senior advisor to the to GLOHRA and Vice Dean of the School of Public Health. I have a specific question to the German representative. Do you see an opportunity for a research network-based funded research program on innovative global health research funding? Having said that, we have identified the problem. We need reliable fundings, but you wanted some disagreement. I'm happy to volunteer. I'm afraid that there is a risk that we try to solve the problems of the 21st centuries with instruments from the 19th and 18th centuries. We heard PPPs, taxing, which is regressive, and philanthropy. Sorry, but this has brought us to the problem we are currently facing.
Thank you for a very controversial ending. Now each of you have 1 minute to answer this because I'm told we have to stick to the time, so that's like 1 minute each. And let's go in the order, starting with Alice and moving down. Go ahead, answer whatever aspect you would like.
I think a number were comments, and I just want to take the question about primary healthcare and innovation.
Can you hear?
And I think we have always looked at innovation as technology. There are so many innovations that are not technology. So it is up to us who want to drive primary healthcare to say which are the innovative way to promote interventions that are working, interventions that have shown success. So that mindset change is what we need to take it up. Thank you.
Thank you. Peter.
I was going to say about the same thing, Alice. Very good.
You can say one other thing.
Yeah, absolutely. Because we know for that, about innovation in delivery in the system. Now, I think here, what was I going to say? No, I can't remember. No.
Let's go to Joel and
yeah,
back to you. Joel?
Okay, thank you very much. What I need to say about research, because I come from Francophone Africa and research is in English, and even researchers in my country publish in English for their career. So I think that we need to make lots of effort to make results from research available to policymakers.
Yeah.
Because I can tell you that most of policymakers even don't read English. So I think it's important to look at this.
Yeah.
So I think that we need to stress this because it's important. So.
Thank you. Peter, do you want to?
Yeah, so the other point is that what I made before, but that we need to connect also with business in the sense of developing capacity, not only the universities, that is really important, but also manufacturing, biotech, and so on, because that's going to be a solid foundation for the future. Because otherwise we'll always depend on outside aid if there isn't a local capacity and economy.
Excellent. Veronica.
Yeah, I wanted to pick up on the student question, which I think is actually a really important one. And I think from our perspective, we have a number of investments in programs to enable career development for international students, but also for German and European students. And that is a thing that comes back to that question: how do we strengthen university systems abroad so that there's landing places, but also how do we have activities, global health activities being distributed around the globe, be it manufacturing facilities, but also be it those actors being present there, so that young talents can be free to decide where they want to pursue their career. And I think to come back to your question with the community engagement, especially in health research, the involving patient representative or other stakeholders who are directly impacted by the work has been proven over and over again to be instrumental. And so it's just good common sense to make sure that programs that are being started from the beginning have that in design, that element that whoever is affected and involved by it should also be involved in it.
Thank you. And last but not least, Michael.
Thank you. Very quickly on community engagement, this is an area that actually on the side of clinical research and clinical trials that has been strengthened in the new clinical trials guidance issued by WHO on strengthening the clinical trials ecosystem. And this is at all stages. Secondly, on the question from the students, we really are promoting investing in the next generation of researchers that understand the local context and also have that global international connectivity to be able to diversify their skills.
Thank you. So thank you so much for the panelists and the audience. I really appreciate the conversation we had today.